food challenges, or oral graded food challenges is the proper name, are done, they're the gold standard for the diagnosis of food allergy. Now, obviously, with the technology we have now with skin prick testing and with serum IgE testing, we're not going to jump right into a food challenge in most situations. So, for instance, if I have a child who drinks milk at an early age and gets hives and has some vomiting, we do a skin test first. Okay, skin test is positive. What we would then do is get serum testing, so blood testing, and what that gives us is a number. So say it's 5. What we would then do is 6 months to a year later, we would recheck that number. Okay, now it's down to 3, and kind of do the same thing. And we have certain thresholds for most of the foods that people can be allergic to. So for instance, with milk, that number falls down in the 1 range or so. So it doesn't have to be negative, but low enough to have a reasonable chance of success with a challenge. We would bring somebody into the clinic and we would have an 8-ounce glass of milk, and we would divide that up into 7, 8 doses, increasing each time. And then we would feed the child milk. And so they'd get a very small amount the first time, observe them for a period of time, checking vital signs and everything. And then if they do fine, you go to the next dose, you go to the next dose until you've consumed that whole 8-ounce serving. And then we watch them for a while afterwards. And at that point, that child is considered to no longer be allergic to milk. That's called an open challenge, which is pretty much the only thing we do in here. In the research setting, there's a double-blind challenge where, you come in on 2 different days. The patient and the physician don't know which day they're getting placebo and which day they're getting the actual food. And we can do that. We just don't do it very often because there's rarely a need for it.